Update on COVID-19. Kathy and Jamie, two very, very busy people here. I'm glad you have the time to come and visit with us.
Yes.
Good morning.
Good morning, Mr. Chair and Commissioners. Yes, we are not short of work, that is for sure. Sorry, I can't even talk to my county administrator because it's just maybe 10 o'clock at night. So our numbers, I've handed out the numbers that we currently have, and you know, if you remember, I'm sorry I didn't attach the numbers from last week, but we're staying pretty steady in regards to not increasing in large number of cases, which is great. So we're keeping the caseloads. You know, the active case is 136 in Clay County. That's great. And then the cumulative cases, 6,606. Minnesota, it's 455, 783. So those are, they're staying, we're keeping them at a steady and decreased rates. The number of deaths, we have 84 in Clay County. And then Minnesota at 6,098. And the out of isolation is, again, the numbers that people have recovered from COVID, and then our out of isolation, 6,329 in Clay County, which gives us the active cases of 136. And out of isolation in Minnesota for 439,283. So they have 10,402 active cases. So we're doing well with our preventative measures. You know, we're still, you know, the masking, the social distancing, avoiding the large crowds, including, you know, funerals and weddings, which is still hard for people to understand. And then we talk about, you know, be careful about your travel, especially international travel. We, you know, with the variant strains out there now, that Minnesota's watching, we have to be careful about being conscientious about whether that is necessary or not. ICU and hospitalizations are remaining pretty well across the state of Minnesota and also in Fargo. So as we meet with Sanford and Essentia, they're managing the numbers. They're really at a pretty even keel, and they have the number of staff, as I mentioned before. So there's a lot of staff that for a while there was such a shortage of staff to take care of these, those particularly in the COVID unit. But we're really doing a really good job, so we really are watching the hospitalizations as well. So we're doing well. Our 14-day case rate per 10,000 people is 36.15. So that's really a good rate when we were way over 100 at one point. So we're you know, we're optimistic, but we also know that this is a virus, so we have to be conscientious about we're not done yet. And so, you know, we continue the measures, and of course now we have a little bit of vaccine, so we're getting it out as quickly as we can, and Jamie will talk more about our vaccination process and clinics. We're getting out what we're getting, and I'll let her talk more about that. You can see the numbers are people with at least one dose, 2,204. And again, remember that those that individuals from Clay County that work in healthcare systems in North Dakota would not be included in this number. So there's others that are working in Fargo that would have been vaccinated because they work in the healthcare systems, and that would have been a vaccination through their healthcare system. So those would not be included in the number of at least getting one dose. So you know, it's a little bit deceiving when you think about the numbers are higher. People with a completed vaccine series is 302. Now, just a reminder that we are still in phase 1A, and so public health is tasked to finish phase 1A. So it's a bit different on the North Dakota side. They've moved to phase 1B, but again, they have two hospital systems that get quite a large quantity of vaccine. So they're able to get a lot more vaccine out to those. That's just in the Fargo and West Fargo side, but even across the state of North Dakota. So And I'll stop there because I'll let Jamie talk more about that. And in the statewide numbers, people with at least one vaccine, 266,985 statewide. And people with a completed series, 67,436. So the number of doses that the state was supposed to receive, 871,650. They received 529,375. This is the Moderna vaccine, and then also the 153,300 that the federal pharmacy programs were distributing to long-term care. So the percentage of doses is only 49%, so the distribution needs to ramp up on those cases, getting that vaccine out. In the next page, I'll just continue with some of the data. The next page, cases reported per week. This is the graph that we showed last week as well, with the number of Clay County cases starting back in March when we started having our first case, and then how you can see the trend and you know, the number of cases really ramped up in the fall of 2020. And then now a decline again. The deaths per week, of course, we had a large number of deaths when we started the pandemic, which was unfortunate. There was a lot of assisted living and long-term care facilities that were impacted. So we saw a large number of deaths, then the decrease for a number of months, and then there was some increases again in deaths per week. And then the cumulative ages by age group. So we have both the cumulative cases and then the active cases by age group. So you can see the difference in the age ranges, but the active cases, you see it's still 15 to 19, 20 to 24, 30 to 34, kind of our top age ranges for the active cases. And that's in comparison to the cumulative cases that you see. And there's there's certainly other cases, other age ranges, they're all been impacted, but the 20 to 24 is the highest in our cumulative age category. And then the back page just is the hospitalizations and the trends for ICU, the number of folks. And for a while, even across Minnesota, there was pretty significant hospitalizations in people in ICU, so there was real concerns about, managing and what would they do if they were overwhelmed. But thankfully, they're at a pretty good pace. We say that lightly because we don't want to see the large numbers of hospitalizations, but they're managing at this point in time. And before I let Jamie jump in, I forgot to mention last week about our case investigators and contact tracers. I think, Mr. Chair, you had mentioned to bring that to the board's attention. So we are continuing with our case investigation and contact tracing. We hired variable hour staff, so we had I believe we have about 10 variable hour staff that were able to jump in when Minnesota Department of Health was really overwhelmed and they couldn't continue. So they reached out to local public health. We jumped in, added some staff, and were able to really manage a lot of the cases in Clay County in partnership with Minnesota Department of Health. We did receive funding based on what we were doing, and our total award amount for case investigation, contact tracing, and this is for 4 counties, so it's Clay, Wilkin, Ottertail, and Becker, our 4 CHB counties. We had $239,760 that were awarded to us. That was supposed to be spent by the end of December. So many of the counties did not hire extra staff. They just used their own internal staff as they could. I think Clay County took on a lot more because we hired additional variable hour staff, which was very helpful to do that. I think we had a good process. We have 88,362 left over, and the state informed us that we could carry that over. We anticipated that they would take that back. They hadn't decided, but they're allowing us to carry over if we're willing to continue the contact tracing case investigation. So That's the amount we have left.
Kathy, I think I reported probably during our committee reports at our board meeting last week about that, and based on that 88,000 and the percentage that Clay County had been using of the previous dollar amounts, I reported to the board, and I think we had talked about it with you, that you thought that might get us through the first quarter of 2021. So that's been reported, and
Okay?
and so I think we're certainly on board with you continuing with what you got going on with those tracers, and it's a good deal, so.
Good. Okay. Yeah, thank you. We're there.
Yeah, Commissioner Mosier wants.
Was that 88,000 for the CHB?
It is. It is. But our financial manager has determined, based on the trend that all the counties are using in our county, that we would have enough through March with what we have. So we can take on a lot more cases, and Minnesota Department of Health we anticipate that we can take all the cases in Clay County, and they can just follow up with some other counties that aren't doing as much locally. So we'll see after March how that looks and if there's additional funding.
Hopefully the amount of tracing will go down as we keep getting these vaccines out.
Yes.
Numbers staying low, right? So that's the goal anyway, so. Yes, Commissioner Kaylee.
I heard on Minnesota Public Radio this morning that kids that are starting to go back to school, be they teens or college students, their families should consider encouraging them to be tested. And when we looked at your chart of active cases by age range, we can see that there are some big numbers there. So can you give us an update on the saliva testing? Is that still going on in the community? So as these families are considering getting their kids tested, they have the current information?
Sure, and actually I have the saliva, the number of tests from January 3rd through the week of January 17th. We've had 7,558 tests completed. And so the Minnesota residents, that saliva test site is still open to Minnesota and North Dakota. And again, just as a reminder, or maybe some of you don't know, North Dakota provided a lot of testing for Clay County residents. So we in turn requested from the state that North Dakota could also be part of this saliva testing. So they included the North Dakota residents as good partners for our metro area. So we have about 1,300 to 1,800 each week for the last 3 weeks that are Minnesota residents, and the rest of them are non-Minnesota residents. So there's still a fair number of people utilizing that testing site. What's great about that is they will collect insurance information, and they can bill the insurance, and so they can accept that as revenue to maintain this site, as well as the funding that initially was provided by Minnesota Department of Health. So that has helped to continue running this site, that they're able to bill insurance. There's no cost to individuals. So if they don't have an insurance plan, or the insurance doesn't cover, nobody will receive a bill. They're able to maintain that. We have not heard yet from MDH how long this site will continue, so we're just grateful it's continuing, because it's a great, it's easy. It's not like a swab test, so people are appreciating having just the saliva testing, and the results come fairly quickly. So there's other testing that can go on, and maybe Jamie will talk about that a little bit for those in higher ed.
As a follow-up to that, are the hours still the same for that?
The hours are still the same. You haven't seen anything that's changed, Jamie, on that, so yes. So we have that posted as well on the website.
So the hours, location and hours are posted on the county.
That's correct. Posted on the county website.
Very good.
Yes. Okay, I'll
you.
let Jamie talk about more of our vaccine distribution.
Okay, I have a few things I would like to share, and I think I'll just start with that, the testing. And so that was one of the priorities addressed last week with Minnesota Department of Health, because we do have students going back to the classroom. We have universities coming back. and sports beginning, that they were really encouraging that population to test. And I do want to add that we do have the opportunity for the in-home testing as well. And so they're trying to make that a priority in Minnesota. Testing is an essential tool that we have to control COVID, and trying to make it as easy as possible. So we're fortunate that we have the saliva testing in town, but also the in-home kits could be ordered as well. Okay, so then I'll go to vaccines.
So Jamie, how do they order those?
You can order that online through Minnesota Department of Health. They ship it to you, and then you ship it back. And so,
Okay.
I haven't
Can we-
tried it.
Can we
but it's an
create a
easy
link to
process.
that, to our?
Yes, there should be one on our website,
Okay.
and there should be one on our Facebook page, but I'll double check and make sure that it's
Very good, thank you.
So,
Okay.
yeah. So as far as vaccine in Clay County, I just want to start by saying that Kathy's leadership is ensuring that we are getting the vaccine out every week that we get. And so typically, we expect vaccine on Wednesday, and we schedule clinics to get it out. And we're doing a clinic today we have 500 doses. So there's a clinic of 500 doses today. We have scheduled 450 doses for Thursday. And those are our biggest clinics. We've had the maximum has been just over 200. So we've been doing at least 2 clinics a day. Things are going very well. It is by appointment only. We learn something new with each week and tweak our process, but we continue to focus on the Phase 1A, which is huge in Clay County. So our team has spent a lot of time and energy identifying healthcare workers and trying to get them connected, because we are inviting them to receive a vaccine through their employer. So that process, Minnesota Department of Health is now adding a link for healthcare providers on their website as of this week, which will help people, if they don't know where to go locally, they can go to the Minnesota Department of Health and say, I'm a healthcare provider in Clay County. They'll connect us to that. We were also notified by the Board of Nursing, so I'm assuming it will be for all licensed professionals that would be notified as well through their licensing agency. We've had businesses reach out through the Department of Human Services to us to notify us that they are in our community. So we've done a pretty thorough shake of what's out there to identify and continue to invite them. So for us, it's been healthcare providers, it has been residents in congregate care settings, and service providers in congregate care settings, of which we have a lot. So we've already done over 1,000 doses, and we're close to that for this week. We also have a partnership with our local clinics. We were able to access some vaccine, 475 doses that we were able to access because we don't have a hospital, and they are busy administering that vaccine this week and last week. So
Commissioner
Riga's-
Gross and I had an opportunity to see your distribution site. And it's pretty impressive, and it looks like you have it very safe setting, so it was nice to see that.
We've had a lot of compliments from people coming through, and then we had a meeting yesterday with the directors in our region, and we are ahead of the others in terms of the capacity that we're able to bring through our site. So we're thankful for having that as an opportunity for us.
And let me just mention with that site, it was the emergency manager for the city of Moorhead, Chad Stanglin, who offered that site, and of course, approved by the city of Moorhead. So it's great. It was a great site, and it was, we were able to ramp up right before our first clinic. So we appreciate that partnership with the city.
I've been in a unique group here, 75 and over, so Sanford has already called me and I've hit my shot, so
Okay,
they're already doing it, so.
good. Good.
I'm sorry, Commissioner Gross, we were so looking forward to providing your vaccine for you.
Okay.
Give him another
Happy.
flu shot. He likes it so much.
So I do have a few more things if that's.
Can we, Commissioner Ebinger has a question or comment?
Yeah, I don't want to jump in, you may be prepared to answer this, but I'm a little vague, and Frank, maybe he answered that for me, but most of us have a provider whose hospital is in North Dakota, and we're Minnesota residents. Does Minnesota provide that, Sanford, or whatever hospital you're going to, do they provide vaccine for their share of the population that goes to that hospital? Or does the state of North Dakota allow Minnesota residents who are part of the, whatever healthcare system it is, to go to their locations and receive vaccine?
Correct. So on the North Dakota side, the Sanford Essentia Healthcare Systems are notifying their patients that they can receive vaccine even if they live on the Minnesota side. On the Minnesota side, vaccine is being distributed through the hospital systems right now. So the clinics in Clay County that have vaccine have received that from public health.
Okay,
I went to the South Side Moorhead Clinic.
okay.
And what will happen tomorrow remains to be seen. They're changing the system in the north, on the Minnesota side, and distribution through the hospital systems may look different.
So Commissioner Gross, that was the clinic in Moorhead,
Yeah, it's South.
which public health provided the vaccine for them to do.
Who provided these in?
Public health.
Like, that was,
is that right?
they're a partner with us.
Oh,
And so we provided vaccine that was allocated to public health so they could get some out as well.
I know they called my wife to set up an appointment, and then she asked about me, and they did an additional one then, so
Okay,
it went real fast, though. They
good.
called at 1:30, by 2:30 we were done.
Well, that's good.
Is it okay if I go
Yes,
on with a
continue
couple?
on.
I'll try to talk quickly, but just wanted to let you know that part of the information and questions that we've received through our agency, we did set up an automated vaccine information line, and that number is 218-299-7204, and I should say IT set that up for us. And when you call that number, it gives you an opportunity for information. If you press 1, where can I get a vaccine? So there's information. And then 2, information on the statewide pilot sites. And 3, information about what Clay County Public Health is doing for vaccination. And then the last is 0, to speak to a nurse. So we want to highlight that, and that is on our county website as well.
And that was a great recommendation. Oh, sorry.
Repeat it again,
7204.
219-7204.
7204.
And that was a great recommendation from our HR director, so.
Credit where credit is due. Then otherwise, I'll just talk about Minnesota in general. The governor announced yesterday that we need to move vaccine faster, so set the goal of that 90% of the vaccine in our hands is distributed within 72 hours, and that additional doses be used up within a week, and we've been meeting that and exceeding that in Clay County. So I'll leave that at that. Otherwise, they're continuing to refine the system for the statewide pilots, and people can actually do it's going on right now. There's a 24-hour period where you can register if you're 65 or over, and after that 25-hour period, they'll do a random drawing. So if you're drawn for a vaccine, you'll be notified that you can register for one of our sites, whichever one you register for, in Ferguson, our area, or Thief River Falls, and your name doesn't go out. So once you sign up, then you would be eligible for the next week's clinics as well.
I want to spend a little bit of time on that, if I will.
go ahead.
I had some conversations with folks that were confused on that. So you call today, correct?
You can call or you can register online for 24 hours.
Okay. So then you register, and then there's a drawing, and then you're told to go wherever, Thief River, Fergus Falls. If you're not drawn, you don't need to keep calling.
You don't need to keep calling, you don't need to register, you'll be in there for the next random drawing.
Okay.
They won't take your name out once you're in. And if you got in last week but they ran out of vaccine, you're still in there, so.
And then if you receive your vaccination in Fargo at Sanford, it doesn't take your name out of that registration, correct?
That is correct. So that would be ideal. You would notify them if you were able to get the vaccine somewhere else.
And I think people thank you for having the number here for us to have citizens call in, but I think people were confused do I call this one instead of this one, how that worked.
So another thing that they're planning for this week, I believe, or they're planning it this week, is a large event for early childhood and K-12 at the Xcel Energy Center, and that is by invitation only. And so people would be notified by their employer if they had the ability to be vaccinated there. So, yeah, so that's, the only other thing is just in terms of the variant, there was a lot of information on the news today about the variant identified in Minnesota. And so we do have the Brazil variant in Minnesota. Our lab is awesome and picks up those strains, and also the UK. But Minnesota Department of Health is really focusing on that we need to do what we have been doing, get tested, continue to follow the guidance of social distancing, masking, staying home when you're sick, and do not travel unless it's essential. And I'll leave it at that.
So Kathy, going back to page 1 of your report, and on the bottom, it had the 529,000 vaccines received in Minnesota. And then we have 153,000 that went to the long-term care. Is that in addition to the 529, or is that part of the 529?
Yes, that's in addition.
Okay. So, doing the math, you know, we're as a state, we've received enough to do probably over 10% of the population. If I'm not mistaken, our population in Minnesota is about 5.5 million.
I think so.
5.2, I think it was.
Okay, so, and when did we start receiving vaccinations? It was sometime in January, wasn't it?
Correct. In Minnesota, are you
Yeah.
talking about? Yes, because I think it was toward the end of December, probably, that they were receiving vaccine.
Okay.
Start, the hospitals, yes, to start vaccinating in January.
And again, those numbers do not include some of our population that has received the vaccine in North Dakota. So
Correct.
probably even a higher number. Of course, these are available vaccines, not necessarily that they've been used, because we've only used 49% of them, but
Right,
hopefully, like you said, the governor is going to change that.
right,
All right.
yeah.
Well, I'd like to see us get to 20% a month. Nice.
Yep. Mr. Chair and Commissioners, we really are pushing. We're in constant communication. They're hearing us loud and clear that, you know, we have the capacity. We have staff, and we have nursing students and their professors that are willing to assist us. We have a few that extra vaccinators that came for our clinic today. So we're really pushing for a more local vaccine because we can distribute that. Plus with our partners, our 2 clinics. So every week we're on 2 or 3 calls and we're really pushing for vaccine. So we're continuing to request. We'll see where we go with that.
On behalf of our citizens, thank you. Okay, Commissioner Cayley, do you have a?
Yeah, Jamie, you mentioned the vaccine clinic that's going on. Did you say K-12 educators? Is that who that was
At
for?
the Xcel, yes, and that is by appointment. So it'd be early childhood, daycare providers, early childhood, and K-12.
And my understanding with that is that's like a lottery system by their licensing agency.
Correct.
So it's not every,
Everyone,
okay, thank you.
you.
Steve, did you have something earlier? Did you? Got it covered? Okay. Well, thank you for your report.
Thank you.
Kathy, we missed you yesterday, but we understand you were busy doing other important things, so. No problem. Maybe you'll get an opportunity Friday to join us. Okay, all right. Thank you.
Thank you.